And for folks who are just joining, we are sharing whose land we're on, and if we can share that link in the chat one more time before we continue with our conversation. All right. Again, thanks everybody for being here today, especially Érica. I'm so excited to have time today with Érica, who is a PhD student here at the University of Washington in health systems and population health, and also a public health researcher. Érica has done and is doing a really necessary worker and people-centered research that focuses on both addressing Latinx health disparities and also just working generally towards more inclusive policies, addressing historic racism and barriers that many farm workers and other low-wage workers experience unjustly. Thank you so much for joining this conversation, Érica, and I want to turn it over to you to introduce yourself and add anything you'd like.
Hey, thank you, Rachel, and thank you to the Center for organizing this event. It's really exciting for me to be here and talk a little bit more about my research. It's really close to home, as I'll share, but I think you did a great job with the intro, and I don't have very much to add. I'm excited to be here with you all, and thank you everyone for joining.
Thanks, Érica. So we're just going to get started, and I also want to name a couple of things. One is we're joining virtually, and that's really great, including that we are in a pandemic. However, there might be some internet issues and all of that, so we will try to get back going as soon as possible if there's any issues like that. And I've had the opportunity to connect with Érica a few times now, and we both can be fairly excited about her research and talking about person and worker-centered research generally. So we're both going to try to talk slow, so the transcription is helpful and useful. But if we are not talking slow, please make a comment in the chat or come off mute and ask us to slow down. Also, we are going to, if you have questions as we're going, please put them in the chat. My excellent coworker, Johnny, is going to help answer some questions as needed during, and then also when we're finishing kind of Érica and I's conversation, we want to turn it over to questions that you all may have. All right, so to start out with you, Érica, I just want to hear a little bit more about what drew you to occupational health and what continues to excite you about your research.
Yeah, of course. So I never really saw myself as an occupational health researcher. I sort of fell into occupational health and public health in general. I grew up in Pateros, Washington, which is a really small town in north central Washington. It's like 600 people. And I say this a lot in my intros because I think it really informs kind of the context in which I grew up and then the lenses that I use in my work now. And so at the time, it's a predominant agricultural worker community in Okanagan County. It's like a prime tree fruit area. And I remember growing up, and I grew up in company housing, and it's like the more that I grew up, the more I realized kind of the inequities that were happening in my community. And it was things like access to healthcare services. There's a shortages of doctors in areas like Pateros. And then there was, I was looking at work conditions and, the low pay, how agricultural work can be really physically demanding. And then it can put you at risk for injuries. And it's hot weather, you're working with like heavy machinery sometimes. So it's kind of like a multitude of things. I also sort of realized that, like many of my peers, if any of our families got hurt, we'd be out of housing basically. And so it's just, everything was so contingent on, staying healthy and well. But then when I looked around, I also saw a lot of like policies and laws that didn't really allow for people to be healthy and well. Like for many families, it's not feasible to, take time off work and go to the doctor. It's sort of like a last resort. And we see this in studies and research today. And so I think it was all of these things that kind of like fueled my passion. And so I was actually pre-med for a really long time, as is kind of similar for public health folks sometimes. And it wasn't until I got to the University of Washington that I found out what the social determinants of health were. And I was like, this is what I've been talking about. This is what has, I've been really passionate about my whole life. And then that's when I kind of landed into occupational health because, agricultural work is really dear to my heart. It's kind of where I come from. And the more that I learned, the more like unjust I saw that some of these conditions were. And so ever since then, I've been really passionate about like work and workplace because people spend a lot of time at work, like the majority of their day. And so when your work doesn't provide you a safe workplace, then that can really affect your health. And I think that's kind of where my passion laid. And so now I super identify as an occupational health researcher, and I work in different realms outside of agricultural worker health. But that's kind of how I started, and I've kind of just gone with the flow a little bit. And this is where I landed.
That's awesome. I'm really glad that you landed here.
Me too.
And I noticed you mentioned social determinants of health, and just so we're all on the same page, can you talk a little bit about what the social determinants of health are commonly known as?
Yeah, the social determinants of health are sort of the environment and the policies and the things that contribute to your health and well-being. It's kind of like your work environment, where you live, where you play, where you hang out, and it's like your access to education. It's all of these things that kind of impact your health that you wouldn't think necessarily would, but do. And so that's kind of where a lot of my passion, especially like in the research that I'll talk about a little bit later, is the policies that kind of help shape those social conditions as well.
Yeah, totally. Thank you so much for that explanation. Mm-hmm. And I'd love to hear a little bit about what community-based participatory research means to you and how you would say that differs from kind of like quote unquote traditional research.
Mm-hmm. Yeah, so community-based participatory research methods, and I imagine at least a few people here on the call, if the majority of them probably have an interest and can be aware, but it's more formally kind of research methods that involve community members equitably in research as equal partners. And so it values and core principles of CBPR, or community-based participatory research methods, is to ensure that community members are equitably involved as partners, and begins with the research topic all the way throughout like data collection and then analysis and interpretations, as well as returning the findings back to community. And so I think I found an article as I was preparing, and because I read about this quite a bit, it's by Wallerstein and Duran, and if anyone has any interest, I'm happy to share as well. But it summarizes a set of CBPR principles that I think are really helpful when you think about CBPR, because it can also be kind of arbitrary to think about. And it kind of has like four main components. It's having a genuine partnership that includes co-learning between academic and community partners. Mm-hmm. It includes capacity building and training community members in research. Findings and knowledge is shared and benefits both academic and community partners. And it demonstrates long-term commitments to effectively reduce disparities. And I think in using CBPR, you're also sort of questioning who has historically been excluded, and therefore who is and isn't represented in the questions asked, how results are interpreted, and how colonization and history of racism affects the knowledge base that we have in the current literature. And so when you don't engage communities most impacted, I think it's really difficult to know if you're missing something or not understanding the context or the experiences of people that you're working with. And sometimes you don't even know how your work can impact people, but bringing in these practices, I think, can really strengthen your research, in my opinion. And it's really necessary as we're trying to dismantle racist systems. And it's really hard to do because it's so embedded in our history and even how like academic environments work. So it's something that I really strive to do in my work. And to me, CBPR means that I'm coming in with an openness in my research and willingness to be reflective and learn alongside the people that I'm working with, checking in with the community and seeing how we can sort of build off of the existing efforts. And like strengthen things that are already happening on the ground, because communities are so knowledgeable and so informed and experts, in their own experiences. And so I think we can really use that and work together to create something bigger and beautiful.
Yeah, I totally agree. And coming from the working directly with the union and trying to work in very member-centered research, I definitely relate to that, and also could relate a little to what you were mentioning about how it can be difficult and it can be a struggle. And I know we have a lot that we want to talk about today, but I wonder if you could speak a little bit about some of the struggles that you can come across in working to do academic research and prioritizing this really important and really necessary lens and approach of community-based participatory research.
Yeah, and I can definitely talk about that. Like even right now, I think being a PhD student, I think that I found, and I feel, first of all, I feel very privileged and grateful to be in this position. Like I've talked about and dreamed of doing this research, and now I'm in a place where I can do that and it's happening, especially with, help from the center as well for funding. But I think like some of the difficulties that I've kind of encountered as I'm trying to implement CBPR in my own work is the kind of like bureaucracy of the university and fulfilling my like program requirements, and then also building like meaningful relationships with communities. And I think I've been able to do that because I was involved in other research projects. But I think if I were here like doing it on my own without having to go through like the loopholes of the university, and some of them are really great, like things like RB that protects human participants, I think are very helpful. But I think in some ways it kind of like to me it almost seems like, okay, you're not allowed to start building relationships or working with community members or recruiting people until after you reach these certain milestones, and then I have so little time. And so in some ways it doesn't feel as genuine. It doesn't feel like I have enough time to really even like work with community to like create my research questions and my interview guides, things like that. And so I've kind of built in some flexibility, but it just means like sacrificing things like time and resources, and being able to stay flexible and maybe having a timeline that's a little bit longer because I want to collect my own data from people from using qualitative interviews. And so those are just some of the things that I've encountered.
Yeah. Yeah, that was really helpful. Thank you for sharing that.
Mm-hmm.
So I know you've worked some, and I would love to hear more about the Pacific Northwest Agricultural Safety and Health Center.
Yeah, I've worked, so the Pacific Northwest Agricultural Safety and Health Center, or PNASH, as I'll probably refer to it from here on out. It's a center under the school public health, under the Department of Environmental and Occupational Health and Safety. And so the PNASH focuses a lot on research and promotes best safety and health practices for workers and communities in farming, fishing, and forestry in the Northwest region. And so they've been a really great resources because they've already kind of established this network and already doing really great work. And so they already implement a lot of CBPR, which is like partnering with workers and employers and communities, and engaging stakeholders to establish research priorities and respond to regional needs, whatever they may be at the time. And so they try to really apply learnings and then share materials. So they're a resource for people, not even just in this area, this Northwest area, but across the US as well.
That's awesome. And so one of the studies that I was really interested in that you participated in the past is the HEAT study. And Johnny, I'm wondering if you can share the link, sharing some resources about the HEAT study in the chat, but also Érica, if you could share some of the key findings of the HEAT study and just generally introduce us a little bit to it.
Yeah, so there was a lot of components to the HEAT study. So I'll provide just a few findings. I don't want to like overwhelm everyone, but one of the main deliverables of the HEAT study was the development of the training toolkit with workers, which I think I'll discuss a little bit later on. But for the HEAT study, it was a study focused on heat-related illness prevention among agricultural workers. And so we looked at different type of health indicators. We looked at kind of improving knowledge using the training and seeing if that would then improve or prevent heat-related illness. People would be able to identify symptoms a little bit better and would also implement practices like drinking more water or clothing, switching their clothing a little bit, resting when it gets really hot. So being more knowledgeable would lead to less heat-related illnesses among agricultural workers. We looked at self-reported symptoms reporting, and then we looked at physiological heat strain outcomes in the study. And so what we did is, this was a few summers ago. Actually, we were collecting data, I think the summer before COVID. We were out, if COVID hadn't happened, maybe would have kept collecting a little bit more data. But our preliminary, like the summer that we were out in the field, we did a randomized trial. And so we gave certain crews the heat training, and some crews got a different type of training, sexual harassment training. And so what we did see is that the average knowledge scores for heat-related illness prevention improved among those that received the intervention versus a comparison group. And we also, for the heat strain, we used heart rate and estimated core body temperature to compute like a measure that's physiological strain index. And we did see some level of like decreases in the physiological strain among the intervention versus the comparison group. And some of these findings were not statistically significant, but they did kind of give us an idea on trends that were happening. And so we also noticed that one of the things that really surprised me, I think, was that there wasn't a clear relationship between physiological strain. So the things that we were measuring, like core body temperature and weekly symptoms reported, the things were kind of like all over the place and dependent on demographics. But we did find that older age, higher heat index of the environment, having 10 or more years of agricultural work experience, and not being an H2A worker, and walking more than 3 minutes to get to a toilet at work were all associated with more symptoms reported, which I think in some sense does make sense.
Yeah, that does make sense. Can you, just so we're all on the same page, name what an H2A worker is?
Yeah, so H2A workers are, they're actually a lot more prevalent in like higher numbers over time, especially in Washington State and in Okanagan County, where I'm from. And so they're workers that are contracted from out of the country. Some of the places like that we contract out from, I say we because I'm part of Okanagan County, but they're from Jamaica and Mexico are two areas that workers are brought in to help with the harvest, the summer harvest month. And they're usually like on their work visas for agricultural workers. So as soon as the season is over, they fly back home. So temporary work permits.
Yeah, thanks for naming that.
Yeah.
So I know you already shared some of the findings and some of the findings that surprised you. Is there anything further to share with that, like findings that you felt that were surprising or that maybe even with your background and your experience maybe caught you a little bit off guard?
I think the thing that really surprised me the most was that so many things can affect whether someone will report symptoms or not. Like, and I'm talking about self-reported symptoms because we did weekly calls once a week to see if they had experienced any of the heat-related illness symptoms within the last week. And we just noticed some trends that like, it could be so many things. Like we noticed that H2A workers weren't reporting as many symptoms, but they also tended to be a community of workers that were a little bit younger, and we're all men. And so you kind of start thinking about like so many things that can affect this because H2A workers are actually tied to their employer. And so if how they perform and how they're working will affect whether they're called back the next year. And so that can also affect like awareness, like the workers just arrived, and although some do receive some training, like not all of them will feel comfortable reporting or even knowing like to recognize the symptoms or to feel like they can and it's safe and they won't be retaliated against. And as much as we don't want to think that it happens, it does. Like people are laid off or retaliated against or mistreated because, you know, they reported an injury. And so it's really hard with research because you're also trying to help clarify some of these associations and then learn from this so we can like create a better work environment. But I think the one thing that this made me think, I guess, all in all, is just to say that we really need to consider the social political context in the US. And sometimes it's a little bit more than just looking at physiological strain or the symptoms reported. It can be a little bit deeper than that.
Totally. Yeah, I really appreciate the bringing up of it being tied to the employer. And I imagine just like the additional barriers that's going to cause for individuals as well as, so really appreciate you naming that. So I know that there was a lot of processes involved developing the heat training toolkit and sharing that with workers. So I was hoping that you could describe that process a little bit, just so we're a little bit more aware of how that was distributed, because that was a very exciting toolkit.
Yeah, and the toolkit is on, I think, the website that Johnny shared. But I first off want to acknowledge that the heat training toolkit was developed by my brilliant colleagues at Panache. I supported some of the work, but I don't want to take credit because a lot of the work was well established before I joined the team. But the heat intervention study included Panache partners, and they worked with Northwest Communities Education Center, Radio Cadena, and Yakima Valley. It's a Spanish language radio station aimed to help communities in the Yakima Valley overcome literacy and language barriers, discrimination, poverty, and illness, and they were a really great partner. And all of the research team, including myself, were like students or people that were working and living in the community or were familiar with agricultural worker communities in Washington, which I thought was a really unique experience as well. And I think they're very like intentional in that way. And so the heat toolkit was developed. They started with a social ecological framework because there's different risk factors that can put people at higher risk for heat illness, starting from the individual level, like your body being able to acclimate to working in the hot weather and your health status, to like interpersonal, and this is whether you're supported and have like a buddy at work that can watch you if they're noticing something abnormal in your behavior. The grower and supervisor, like work environment and provision of shade and water, and whether that employer has a heat prevention plan. And then there's also community housing. And so whether you have cooling opportunities outside of work, when you go home, are you able to cool down, or can you go to like a library or a pool to cool down? And so these are taking all of these into account. They wanted to develop a toolkit that really addressed some of these areas. And so they worked with two advisory groups. One was a technical advisory group, and the other was an expert working group that included farm workers and managers. And so they kind of developed these training materials and then would give them to the advisory groups to provide feedback. And it kind of was like a learning process for everybody. And the final heat intervention consisted of two things. It was a heat training that had a lot of visuals and took into account that some workplaces don't have a lot of resources or space to conduct these trainings. And so they were really flexible. Like when we were doing the field study a few years ago, we were outside of work right after they had gotten done, and we were outside and we had our boards ready to go and propped up. So it's like very simple and easy and accessible to do. And then the second part was a supervisor heat awareness application that addressed risk factors for adverse heat health effects at multiple levels. So it kind of advised, it was an app that the managers would download, and they would get notifications of the coming week and the trends that they were seeing, and also the advice for what they can do, like work under these times because it'll be less hot, or make sure you take breaks, make sure you provide more water because it's going to be hotter, things like that. Yeah, so that's what that's how it was developed.
Yeah, that's a lot of different interventions and approaching a lot of different things. Thanks for sharing that. So I know a lot of people, including myself, and I know you and many others, were very excited to see that there was emergency heat protections that came out earlier in this year due to the work of many people, some of whom are on this call. And I'm interested in kind of what your initial reactions were to that, and anything you'd like to share about that time frame when that was happening. And folks were talking, I think, a lot about the heat work and other work that's being done both in academia and definitely outside of academia as well. Yeah.
So for my thoughts for the emergency heat protections, I tend to have quite a bit of thoughts that kind of range and sometimes aren't very well organized. So anyone feel free to ask questions if I'm sort of answering these questions all over the place. But I kind of geek out on policies and kind of how these changes are happening across the US. So Washington is one of 5 states with permanent heat rules. The others are California, Oregon, Colorado, and Minnesota. And so in that regard, I'm really glad that we live in a state that prioritizes safety and health for agricultural workers in the hot summer months. And there's actually been some changes in the permanent heat rule, from the emergency heat rule to a permanent one. And I did want to share those links because I think it's really cool. My mentor, June Spector, I was talking to her as I was preparing for this, and she shared this, and I think it's really awesome. So if anyone's really interested in the heat rules, here's some cool links that I think you could check out. But my main concerns when these heat rules came out is were about enforcement and how the differing pay mechanisms during the seasons will affect implementation.
Mhm.
So, for example, one of the requirements is that paid mandatory cool down rest periods of 10 minutes every 2 hours when the temperatures are 89 degrees Fahrenheit or hotter.
Mhm.
And so LNI and the other stakeholders who are organizing and like editing these heat rules, they're really thinking about how to change this also, because 89 degrees Fahrenheit isn't like the threshold. Like it can, you might need, if it's hotter than that, people are going to be needing more rest. If people are wearing personal protective equipment at work, they're going to need more rest. Depending on the task that they're going to do, they're going to need more rest while it's really hot. And so they're really keeping this in mind, which I really appreciate. You can see that in those links. And so although I tend to be a pretty optimistic person, I think it's really hard for me to envision that all employers will abide by these rules. And it's not because I don't believe that employers want to prevent heat-related illnesses, but I think that we see this time and time again where, depending on your literacy level or educational background, documentation status, awareness of your rights and policies, and all of these things will affect whether a worker has the tools and knowledge they need to advocate for themselves. And if they work somewhere that isn't following these rules, I think that'll be, a bit of a challenge.
Mhm.
And additionally, I think pay mechanisms, so like piece rate. And so piece rate is where you get paid by how much you harvest for work that you complete in a certain shift or time frame. And so those type of pay mechanisms don't create an environment where workers would want to take a break, because it would be kind of a financial sacrifice.
Yeah.
And we also know that, as talking back to social determinants of health, income also affects health. And so workers are having to make a decision in the moment to take a 10-minute break to keep physically well or keep working so they can make a living for themselves.
Yeah.
And so I think that's just another factor to keep in mind. And I think that their LNI is trying to think about labor and industries. LNI is trying to think about keeping this in mind and how do you reduce this thinking of like keeping track of the temperature and how much rest workers need to reduce kind of that burden on employee and employer responsibility.
Yeah.
But it gets really complicated because, a lot of my work is focused on labor policies and laws, and you see that it's not just that, the second step is kind of enforcement, and there's not capacity for that.
Yeah.
So anyway, but heat-related illness is preventable, and
Yes.
and so it needs to be something that's not the responsibility of just workers at the individual level,
Yes.
but also the policy, which is being worked on right now, but also the employer and community levels. So
Yeah. That was one of my first reactions too, was trying to unpack what is on the employee versus what is on the employer, because it does feel like sometimes, even with the best of intentions, without there being more on the employer and there being, like you mentioned, the enforcement angle and the staffing and the actual plans for that, it can feel a little like, this is great, but what does it mean? Thanks for going into that and unpacking that more.
Yeah, of course.
So I'd love to continue talking about this forever, but as you alluded to earlier, you also received a Washington State Labor Research Grant, which is every year the center is able to distribute these, and they are for folks like Érica, who's doing policy and worker-centered research that has policy implications here in Washington State. It's a program I'm really excited about. I also identify as a policy nerd, so I have that in common with Érica, as well as being from a small town and a few other things, but we don't need to get into that now. I would love to have you describe, I want to describe it, but I'm going to let you describe it because it's your research and it's so cool. A little bit about the research that you have proposed, that you got the grant for, and the title is Examining the Association of Labor and Social Determinant-Related Policies on Workplace Safety and Chronic Health Indicators among Agricultural Workers. So whatever you feel comfortable with sharing with the group, would love to hear a little bit more about your thinking behind that and just where you're at right now.
Yes, of course. And it's so great. I'm so appreciative of this award. I think I've had it in my mind to apply. I just haven't been in like a very good spot to do so. And so this came out at the perfect time, and I'm so grateful because I even talked to my committee members where I've been talking about this even from my master's program like years ago of these ideas, and now I'm like at a point where I can almost start collecting data. So I'm so grateful to be here. and be doing this work. Well, I guess I'll start off with, this is the way that I always start off when I talk about my research, and it's because I think it can be such a specific area. I'm basically trying to look at how labor laws that expand protections for agricultural workers at the state level are associated with different health indicators. And I'm looking at health indicators that are like workplace related, but also like chronic health, like your overall health and well-being, and mental health indicators as well. Because I think, like I mentioned before, I think that your work environment, you don't just kind of like leave it at the door. You, especially nowadays when work is your home also for many of us, you know, like all the stress and your work environment can be brought into and affect your health even when you're not at work. And so I start off with this, with emphasizing that, you know, there's a lot of agricultural workers, and they're the people that feed the United States. They feed everyone. And so when I emphasize that, I think it's just kind of highlights how unjust it is that if you look at a federal level, agricultural workers are excluded from a lot of labor law protections and policies. And this isn't a coincidence. The fact that they were excluded has a lot of racist roots. And so, you know, states are doing some level of expanding protections like minimum wage provisions and overtime pay. But it's sort of things that, you know, the average worker is entitled to, except for domestic and agricultural workers, which were excluded back when some of these policies were passed for the first time. And so you look a little bit deeper, and you see that the vast majority of agricultural workers in the US are immigrants, with 75% of agricultural workers being born outside of the US, and about half being undocumented, and over 80% are Latinx workers. And so you have agricultural workers that are kind of experiencing structural racism at the intersection of labor and immigration laws. And that kind of just can compound what it can lead to. And it's things like, you know, like their paid minimum wage, they experience wage theft, unsafe labor practices, workplace injuries without legal recourse, due to the lack of labor protections. So it's all of these things, right? And so I think the more that you learn, the more frustrated that I would sometimes get. Again, a policy nerd. And so what I'm doing for my research is, you know, like summarizing all of this. And for my aim one, I'm interviewing agricultural workers and other stakeholders here in Washington State. And I'm asking them about, like, what are your priorities for the laws that you want passed? What are the laws that you think are affecting your health the most? And seeing if those are the things that are matching up with what is passed into law, or if there may be things that are passed in law that people are like, what, I didn't know I get overtime pay now. You know, because some of these policy changes are also changing more recently, and they're coming in waves. And so I really want to get an idea for how people are experiencing these labor laws and protections, or not, you know, on the ground. So that's my first aim. It's a qualitative aim data collection that I'm doing. For aim two, I'm developing, and dissertations are kind of organized in aim, so that's why I'm talking about it in this way. But for my second aim is summarizing the labor policies across the United States by state. And so really quantifying, you know, like, what is the level of protection in Washington and California and Colorado, and seeing basically the states that have expanded protections would get a higher equity score, and states that haven't like made any recent changes or kind of default to the federal level, which is little to no protections for agricultural workers, that, you know, they get a 0. And so looking at how these scores are then related to agricultural worker health indicator data, workers from those states, and seeing if we're seeing any trends. And that's my third aim, is seeing how, you know, how are we seeing these trends between the laws that are being passed and workplace indicators, like, you know, is there sanitation at work? Do you have access to water? How is your, you know, chronic health? How's your mental health? And I'm also looking at access to health services as well, actually. But the policies that I'm including expand aside from labor policies, and I'm looking at like Medicaid expansion and looking at like immigration policies, to really get a scope for, you know, the political environment in that state. Yeah, I know that was a lot, but that's what I'm doing for my dissertation.
It was an exciting a lot. I really love the approach of like the whole person, you know, like this, it's not just only the labor policies that impact us in a state, it's all of the policies, right? Like it's all the policies that impact our day-to-day lives, and thinking about the intersections that you mentioned earlier around racism, historical barriers, as well as immigration and the barriers that come up there. It's really great that I'm so glad that you are focusing on these full personhood policies as well as labor policies, which I also think are incredibly important. So thank you for naming that. So we're going to turn over to, I think there might be some questions coming in, and please think of questions. Don't be shy. We're wanting to have these regularly conversations with folks like Érica, who are doing really exciting research and working with the community directly. But I'm interested in, what advice do you have for researchers who are hoping to center and trying to center and include the voices of communities, especially workers, in their research, and keeping that framework of what you mentioned earlier with there is difficulties and there can be bureaucracy and it can change timelines, considering all of that. And we know what's at stake. We know that centering people leads to more equity, more anti-racism, like in lived values. But generally, like, do you have some advice or things that you'd want to share with other folks?
Yeah, I really like this question because I think it also reminded me of like, oh, what are the things that I can do? Sometimes I get really lost in my work and like everyday research, but I really like questions like this because I think it brings me back to being very intentional with the decisions that I'm making in my research. And so I guess I don't know if you can adequately do a lot of this work without including the people that are most impacted. I think it's really helpful to look at community-based participatory research along a spectrum. I think that's more helpful versus you're not doing it, because that can be kind of harsh also, and we're all learning and trying to do our best. And so we want to aim to have the most equitable environment and practices to center and include communities. But sometimes, we're limited depending on the context that we're working in. You might be at a government organization or an academic institute. And so wherever you'll be, there'll be some challenges. I don't wish that upon anyone, but that's the reality of a lot of places. Yeah. But I think it's about finding creative ways to include communities, and maybe you won't end up exactly where you want to be, but holding yourself accountable and just striving to do what you can. These little changes can sometimes be disheartening because it's not exactly where, I'd want to be. And it's happened to me where, as I shared earlier, but there's also a lot of power in making change towards, where you want to be, and shifting kind of the mindsets and how research is conducted. And another thing to keep in mind is to truly understand why you're trying to center and include the voices of communities and workers in your research. I know that there's a lot of conversations on health equity and justice, and Rachel, we've talked about this too in one of our prior conversations. But I think really understanding what this means for the specific group you're working with, like, why are you including race and ethnicity in your models, in your statistical analysis? Like if doing a little bit of background work where you really understand kind of how systems kind of created the disparities that we're seeing can really make a great impact. And I don't think you need to know everything, but taking the time to dive in and familiarize yourself with the community you're working with that has been historically excluded, and trying to figure out who's missing from the table, and why they're not being able to be reached, and what are the practices and policies that might have impacted why they're not being reached. I think taking the time to do that, I think, is really beneficial. And I think lastly, the last thing I'll note is think about how the work you do can and will benefit the communities you're working with. I think if you don't know, you can ask and have this conversation, and you don't have to overcommit to a deliverable that you can't produce. But I also think that the work produced shouldn't be just, publishing an article where people can't really access it. It can be like making it open source intentionally. It can be ensuring that when you publish something, maybe create a short report so communities are aware of the findings from the research, or maybe doing radio programs or podcasts or anything that will make knowledge more accessible. And then maybe communities will have questions about resources in the region that you can help make that connection. And by providing an info sheet or using your network to connect people, I think all of these things are valid ways to kind of implement and incorporate. And I think they're needed as you're doing your work.
Thanks. Yeah, that was, there's so much in there that I'd love to pull out and ask follow-ups to, but you know what, I'm not going to. I'm going to control myself. It's 4:44. I want to turn it over to some of the other questions that I've seen in here, but I just want to name, I really appreciate one thing in particular that you said. All of it I appreciated, but naming that you don't need to know everything, I think, or you don't need to be an expert. You need to be willing to learn, I think is something that I think about myself as a white person working to do racial justice work and anti-racism work. I think sometimes this feeling of like, maybe I don't know enough can be a barrier for people. So naming you don't know enough and working to learn more, but also centering the impact of people needs to be prioritized. So thank you for sharing all of that. So I'm going to invite Johnny to help with some questions that may have come up in the chat. I was not looking at the chat because I get easily distracted. So Johnny, if you can maybe pose some questions for Érica, and I'm going to go on mute. That's okay.
No problem. Thank you, Rachel. Again, Érica, everything was super well said, super informative what you had to say. Thank you so much for taking the time to do that. One question that we got was asking about what are some ways that you will collect data in the various states, referring to your upcoming research, and maybe the potential timeline about that? And, you know, maybe would you be interviewing workers in other states in the Northwest?
Yeah, that's a great question. Thank you, Rebecca. So at this time, I'm focusing on interviewing participants in Washington only, which is a limitation. But and the timeline would be this upcoming fall. So within these coming months, or it would probably be maybe October, November, December, as time allows. And it's not because I'm not open to collecting outside of Washington. I think it's just for capacity. I'm sort of self-funding through like applying to grants like the Harry Bridges Center, which is actually my main source of funding for a lot of this work. And so because of those reasons, I'm not planning to, but I'm not opposed to it. And I think it's something that if, you know, you want to work together and you have an interest, I think I'd be totally down to, you know, interview and include workers from Oregon, especially since it's so close. It's a neighboring state. And during the heat study, actually, we worked with some workers that were in Oregon. So it would be really feasible since it's around the area. But that's my timeline and that's my current plan.
Thank you. Another question was referencing about the heat study that you had done, and asking about how did you avoid contamination in the trial, knowing that farm workers, you know, closely work together, and that they might have talked about the treatment that they received.
Paul, that's a great question. It's actually something that we thought about, and there was no way to avoid contamination. Like we recognize this, especially with like, you know, like I'll talk about H2A workers because they lived in the quarters closely together. And so we had zero control over how the crews were divided up. We worked with the employer. And so they gave us a few crews that could participate in the study. Of course, all the participants chose to or not. And so, but then those crews can like live and be like neighbors to each other and like be dorm mates. And so they could definitely be sharing information. I think what we ended up, like how we addressed this problem, we couldn't really control it, is we thought about that it would just move our results to the null because it would be sharing knowledge information and heat-related illness preventions, like tips. They'd be kind of sharing that information and sort of preventing, hopefully, symptoms and increasing knowledge. And so we'd see kind of like, we wouldn't see as great an effect, as stark of a difference between those who did receive the training and those who didn't. And so because it was swaying towards the null, I think it's a better alternative than, you know, having it go the other way, where if it could really affect our results and sway them and make them non-believable. And so I think we had to make kind of peace with that. I know that's not the best answer, but it's sort of how we combated it.
And then one comment that we had was more about talking about Radio Cadena and how it's no longer a trust organization, you know, with their experience of workplace violations and union busting. Maybe you could expand a little bit more on that.
Yeah, I'm happy to. I'll make it really brief because it's going to be very long. So I'm Adriana, Director of of Outreach and Education at Fair Work Center, and we are a statewide nonprofit that does workers' rights. I also have my Master in Labor Studies from the CUNY School of Labor Studies, so I'm also nerding out here, and thank you for putting this together, and Rachel for inviting me. And yeah, we look forward to finding ways to collaborate, but as someone that lives here in Yakima Valley, you know, when you are going into small rural areas, small communities are tight knit, and you know, you can see bigger organizations just taking over resources, and it makes it really hard for small organizations like mine to be able to get the resources that are going to go directly to the workers. And here we serve workers in our worker center, and so I've just experienced, have had bad experience, and have had workers come into my office with these complaints. So it's just, you know, as an advocate and a workers' rights person, you know, I have to be holistic about who I'm working with and who I'm not working with. And unfortunately, there's somebody that Radio Cadena that's doing harm in the community that is that people just aren't exposed to it unless they're living here. And so yeah,
I think
and I
that's
hope that changes over time, but
yeah. No, I think that's very real. Adriana, like I've totally seen that, and I think I can totally see. I think this is where you really do have to be intentional with who you're working with. And you know, they can be doing, because Radio Cadena has done some like heat related illness prevention like shows where we've kind of been on and talked about some of the research and practices to keep workers safe during the summer. But then, you know, it's very real for them to also be, you know, mistreating their workers. And so kind of having that like dissonance happen is very real. And I wasn't very aware of it. So I appreciate you sharing, and I would be open to collaborating. I think all we can do is do better than that. And, you know, in this work, we have to stay optimistic, but I love to work together, Adriana, because I am trying to, Yakima Valley is one of the regions that I'm working with. Yeah, no, you're always welcome here in San Rochinapa. And, you know, exposing a trusted organization, I would put in quotation, it's hard. I always get heat for this. I get reactions all the time, and I'm like, that's part of being an organizer. You can't be scared. And so I'm not scared. I'm doing the work directly with the community, and yeah, always happy and always willing to support work, anyone that wants to come out here and collaborate. And thank you for your work. It's so beautiful to hear all this. Like, I don't do policy, but I nerd out on research. Oh, cool. Yeah. Thank you.
And we don't have any more comments, but if you have anything else you want to add, Érica, it looks like that was all the questions and comments for now.
I think, I don't know if I have anything else to add aside from that. If I will be reaching out to some of you who have expressed some connection, because I think that, you know, I'm trying to build capacity and also, you know, gain your perspectives, and you all are also doing great work here in Washington. And so I'd love to kind of collaborate and work together to create something that can make a change. And I'm hoping that one day, you know, I can move on to something else, because agricultural workers will be working in safe and healthy environments. But that's the idealistic side, and all workers also. Yeah, I don't have anything else to add. I do appreciate everyone for being here and having me.
I think that might be the organizer side too. We have to believe that will happen. Yeah, do the work. So I really want to thank all of you for coming out today. And if anybody, we have a few minutes left. So if there's any questions, folks can come off mute if they'd like to just jump into the conversation. We want people to feel comfortable doing that. And also can put questions in chat if you'd like. But I really want to I appreciate you taking the time today. Érica shared with me earlier that she's has her oral exams coming up in a few weeks. And I know that it's just a busy summer of preparing research and doing that research. And I love talking with you, and I love getting to know more about your research, and just having those connections, and hope to do more of this in the future. So yeah, just want to give it a couple minutes if anybody wants to ask a question to Érica, or to just name anything that they're thinking about with community-based participatory research or anything else that came up. Yeah, we have the space for a few more minutes, and jump on in.
Hello. Hello, Rachel. I'm a policy Iowa chapter fellow, but I'm also a grad student at the Evans School of Public Policy. I'm mostly interested in, because I feel like our department don't have environmental justice. So I'm really interested in trying to study the effects of environmental policy on communities of color, especially those farmers and laborers. So do you know like how maybe I can start with like research or like connecting with that kind of work?
Immediately, what comes to mind is if you had been connected with the Department of Environmental and Occupational Safety and Health at the School of Public Health. I think that they are doing some environmental justice work that I think you'd be really interested in, or that would align with some of your interests. And I like the interdisciplinary aspect. Actually, I don't know if you know Heather Hills. She's a part of my dissertation committee.
Program evaluation.
Oh,
Yes.
yeah. She's so good. She's so good.
Yes.
Yeah. And so she's my policy person too, who's helping. Like, I have my public health folks, health services folks, and then she's kind of bringing in that lens. And so I think you would really, well, I think you should talk to her too, but also the Department of Environmental and Occupational Health. And I think health services kind of does a lot of like wide range, and I can share some resources if anything comes up afterward, Paul.
Okay. Thank you very much.
Yeah, thank you.
That's a question, Paul. Oh, before we close today, I really want to make sure that I say thank you to all of my coworkers and all the folks at the Bridges Center, as well as obviously to Érica for taking the time today. Johnny, who jumped in and helped with all the stuff like pinning us and making sure that we didn't accidentally shut down our Zoom, etc. Johnny, you're the best. Yasmin and Andrew, wonderful coworkers, and all the faculty, staff, director, etc. of the Bridges Center. And yeah, so I think we'll wrap it up. Thanks again, everybody, for making it out here or making it in virtually today. I don't know, making it out here. I don't know what that means, but it's good to have you all. And again, thank you for sharing your research and your thinking around your work, Érica. It was great to spend time with you again today, and I look forward to doing it more.
Yeah, me too. Thank you so much, Johnny and Rachel. It was really great to be here. And thank you everyone who joined.